please join me in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. So I'll start with our introductions. I am Gail Demore, Madam Chair, and with me we have board members Dr. Ed Weiner, Andrea Sheehan, and Dr. Marwa El-Sahabi. In addition, we have our professional staff with us, Susan Luminello, Director of Public Health. We have Michael Green, Associate Director of Public Health, Christine Mathis, our Environmental Engineer, and Marlene Johnson, our RS Health Agent. And online, we have our Recording Secretary, Miss Julie Frockingham. So I just would like to say thank you for all that you do. Please note, we are online and live and will be taped by BCAT and are available for appropriate comments and questions through this technology. Thank you to BCAT for what you do and all that you do with this community to keep us all well informed. I did have a request to take something out of order from our agenda, which does need to be voted on, so I'm wondering if I can do that now. It is the hearing, which we have one hearing today for the keeping of animals, so could I have a motion to put that forth first in the agenda?
Ms. Chairman, I move, I make a motion that we take the keeping of animals, the hearing out of order.
I'll second that.
All in favor?
Aye.
Aye, great. So we'll start with the hearing and go into the chairman's report and subcommittee updates.
Yes, you can start.
Perfect. So I believe the keeping of animals, the chickens and hens, 1 Liberty Ave, are you here and could you come forward? Yes. Please sign in and introduce yourselves.
Warren and Lynn Chia from 1 Liberty Avenue, Burlington.
Did you want to do an introduction?
Yes.
Marlene, or thank you?
Yes. So the permit holders, Lynn Chia and Warren, okay, is it Warren Chia as well?
Warren, yeah.
Thank you, okay. So they hold a keeping of animals permit. They're at 1 Liberty Ave. They received their permit on August 24th, 2021. The Board of Health approved a keeping of animals permit for chickens. Paperwork is attached showing the coop and enclosure around the coop. No changes to the setup to date. We've received a complaint. The abutter logged a complaint of rat activity between 1 Liberty Ave, so their property, and the complainant's property, which is 3 Liberty Ave, via the white fence that abuts both properties. So when we received the complaint, we did an investigation. So it was an unannounced investigation at 1 Liberty Ave. I went out with Samantha Ellsworth, the Associate Health Inspector. We inspected the storage of the feed because we suspected that maybe they were attracted to food, so that was our focus. After our investigation, I heard from the complainant at 3 Liberty Ave, and he requested a visit because he wanted to show me where the rats were coming in on his property. So on August 18th, I went out and I did find evidence of rodent activity along the fence that abuts 1 Liberty Ave and 3 Liberty Ave. And there were photos, and the ones that I took, I noted with my initials.
Yes.
And then Susan Luminello and I conducted an unannounced visit at 1 Liberty Ave on September 4th. And when we went into the backyard, we inspected the area along the fence now that we knew where to look. And 1 Liberty Ave, their backyard is fenced in, completely fenced in, and they have a retaining wall that comes up maybe about 3 feet or so, and then the retaining wall goes back about maybe 3.5 feet. And then there's the white fence that goes up about 6 feet, 5 or 6 feet, and that fence is what abuts the neighbors. So 3, his property is a little higher. So that's why they have sort of the retaining wall. So Susan, do you want to show a video? So we have a video that the abutter at 3 Liberty Ave provided us that shows rat activity.
Just,
Do we need the lights dimmed?
I just need to play. Oh, here we go, all right. It's only like a cup, it's not
Okay,
very
yeah.
long. Here we go.
And that's the fence. Tom, right? That's the fence? Is that the fence?
Let me play it again.
Yeah, played again. They sent so many videos. No, that is now under my shed. So that's where they ended up going underneath, because I got a garden in there.
Okay. So there's something at 1 Liberty Ave that they're attracted to, whether it's food, water, or even could be shelter. There could be a nest. So we have them before the board tonight, and they can provide testimony if they like, but to order the permit holder at 1 Liberty Ave to provide pest control services and seal the fence according to the recommendations of the pest control service, provide a copy of the pest control service report to the Board of Health no later than October 28th, and failure to comply may necessitate another hearing before the Board of Health, or the board may revoke the keeping of animals permit and set a date that all chickens must be removed by. I do want to mention that today, around 3:30, 4 o'clock, I did receive an email from Lynn Gia, and this is a copy showing that they have hired pest control, correct?
Yes, that's their
So-
proposal.
Did they come and visit, or did you do
They came
this?
and visited.
Okay. I'm just surprised that this isn't signed. Do we have a signed copy?
I don't have a signed copy. They emailed that to us.
Okay. I'm surprised they didn't email you a signed copy. It doesn't say what pests are covered here either, and it does say that it's going to be a bi-monthly service. Does that mean twice a month, or does that mean every other month? It's unclear.
The way that it was described to me was that it's a program that will last for somewhere between 6 months and
For
a
a
year.
year, right.
And they'll come back repeatedly, and they will come back more often in the beginning because they need to monitor how it's going. And then I think eventually it becomes bi-monthly, which is like once every 2 months, but that's sort of towards the end of the program.
So when they made the visit today, what did they,
The visit was over a week ago.
oh, over a week ago?
Yeah.
This is dated today, though. Is that because they sent it to you today?
Yeah. We've been waiting for them to put that together.
Okay. When they came and did they take a look at your property?
They did, yeah.
What did they have to say? Did they find any,
Yeah, they did say that some of the tunnels that we're seeing are rat activity, evidence of rat activity,
where are those on your property?
along the fence line,
Along the
And,
fence line? In the retaining wall?
in the retaining wall.
Did he give you any recommendations of how to mitigate that?
That's the plan that they put together as a mitigation plan for setting up setting up trap stations along the fence.
Okay, so the only thing that this says is program will include 6 exterior stations around the property?
Yep.
So that's the plan?
And yeah, all of that is along the fence because there's no evidence of anything in any other part of our yard.
Okay. Because I recall in your yard, you have some compost in the back.
Yeah, there's nothing there.
So they did check that?
Yeah.
Okay. And then there was like a wood pile, too? And
Nothing there.
did they check under there?
Yeah.
The tech? How many technicians came?
One.
Just one?
Yeah. Well, we had 2 companies come to look.
You did?
Yeah.
Okay.
Kind of the same thing. This is the one that we felt that knew what they were talking about a little better.
Okay. So I just feel that the report's not very complete. So what I would recommend is that since they did provide pest control, and it sounds like they have a contract with them, I'd like to get copies of their reports. So that would be something I would ask that you require them to do, is to provide the reports to the Board of Health.
Sure.
No later than, I think, 3 business days after service? I think that's realistic.
Yeah, and you should make sure, too, that they provide a report every time they come out. So if they're coming out, over a span of a year, we should continue to get those reports.
Okay.
So, yeah, just let them know that. Just say that the
I will.
Board of Health is involved, and I need to get documentation showing that I have service. Okay.
I have a quick question, if I may.
Sure.
So they came out and assessed the situation, and this is a contract that you'll be starting, or has it already started?
That I will be starting.
When is the date for starting?
I need to schedule. They just need to come back out. They said they can do it within a week.
Okay.
So we probably want to put that into the contingency that
It
within,
needs to start sooner than-
yeah, within
Yeah.
7 days.
Madam Chair.
Yes.
This has been a month. This has been a month that this has been going on, and this started on August the 18th, and we're now October, and October 14th, and I'm a little concerned that it's been 6 weeks and nothing's happened. I really am. And I'm not sure what our professionals ordered, but I'm sure that they made recommendations because I know our professionals are very good. I know Marlene for 100 years. If we decide not to revoke the keeping of animals permit, I want to keep this open. I want to continue this until we find something that's going on. And I want them to come back. I don't know, maybe my professionals can tell me on both sides here, how long does it take to get rid of rats?
Well, that's a question that, I've wondered myself. I think one of the key things would be finding their nest and where they're nesting at. So I think that, and I don't know if your pest control had found any nests or anything like that on your property. So finding nests and getting rid of them, doing regular pest control, getting rid of a food and water sources. So the compost pile, could be, even though they haven't seen any activity over there, they could be getting food from the compost pile. So maybe considering getting a bin or something to keep your compost in so that they don't use that as a food source. So I think and this is something that we haven't had here in all my years, but I'm starting to see it more often. So I think that there's many factors involved in this, and that we need to look at all the factors. Now, the neighbor is here. We've been to the neighbor's house. We did not see any possible food sources at the neighbor's house, although, that's probably something you want to look at as well. Is there a nest maybe over at your house, and they're coming from the fence, they're nesting at your house and coming over to get the food? So I can't answer how long it's going to take. So, and I don't think a pest control company could answer that.
Well, between now and the next meeting, I really think that we need to see some substantial activity from the pest control company. If we decide not to revoke the substantial, the problem if we revoke the keeping of animals permit, we lose the opportunity to rid this whole thing. And I want to see substantial activity between today and our next meeting, and I would like to see the proponent come back 1 month from today and see where we are. I mean, I think that our abutter, we gave them a permit 4 years ago. I'm not sure remember if the abutter was here or not.
I was not here.
He was not
I have
here.
no objection to the chickens.
Okay.
I think we should give you
My
a,
objection is the rats.
And I clearly, I understand
I had
that,
to throw away my whole vegetable garden because of the rats. They got into it and destroyed it
and I'm sorry for
and
that.
and urinated in it, and I had to throw it all away.
I,
A good substantial amount.
but I want to see some substantial activity in the 2 weeks between now and our next meeting, and I would ask our professionals to confirm that that happened if we decide not to. And then the second is I would like the proponents to come back in a month, and then we will, if there's been no change, then there may be some more draconian situation. But nobody should have to, in a neighborhood, put up with rats, although we're seeing it all over town now.
Well, not all over.
All over town, but in areas, we're seeing it again tonight, in another aspect, too.
In some, yeah.
Another area, too.
Complaints.
Yeah, and we've never had that issue, never.
we haven't.
No.
May I ask a question? So are the other complaints that we're hearing, are they all related to other, keeping of animals? I mean, I just don't know if
No.
this is a separate issue from
This is-
chickens, right?
This is,
Not related to keeping of
So are we
animals.
sure in this case it's related? I mean, I'm just throwing it out there. Are we sure it's related to the?
Well, so we have to think of what is the source,
Right, exactly.
right?
I'm wondering.
So in the other cases, there may be, a trash, like a dumpster
I see.
around or something,
Okay.
which is a potential food source. So
Okay.
you have to make sure those dumpster doors are closed,
Yeah.
things like that. In this case, it could be a compost
Yeah.
pile, it could be the chicken feed, it could be.
Yeah.
a
could it
vegetable
have been the garden, like
Ye-
partly,
they
that
could-
attracted them?
Yes,
or-
a vegetable garden or something like that. Or-
But
I know
then they-
have plants-
like they're right
Along your
there.
fence line, they have like.
Berries.
Berries and things like that.
Okay, so you do too, yeah.
Yeah. So,
So it's hard to say what attracted them, but now they're here, and how do we deal with this?
right.
So I think we need to deal with this, starting today.
And just on that note, we don't have a meeting, the first meeting in November, because it's on like Veterans Day. So we have a meeting the 2nd November, which is the holiday week, but we still could have the meeting that week. And then our meeting after that is the first week in December. So
Is there
I
no
would just
meeting
want
on
to
the
know when you
28th?
would want them to come back.
Is there a meeting on the 28th?
That's 2 weeks from now. So if you want them to come back in 2 weeks, I mean.
Too soon?
I would like to see between now and the next meeting, though, a substantial reaction to the rat problem.
So probably what they're going to do, and Marlene, correct me if I'm wrong, will put out some bait boxes. along
They're
the-
pest control, so
Yeah.
we want your pest control person out there as soon as possible, so that they can begin treating and you can get this under control.
Yeah.
And then we want to get a copy of that report as well.
So in the next couple of weeks, what they'll be able to do is get the pest control out there, get the bait boxes up, and then wait for the rats to get into the bait boxes. They'll likely find dead rats around the property, and so will the neighbor. And then the pest control comes back and then rebates the boxes and determines like how much bait has been taken from the box, or whether that's,
But I would like them to come back at the next scheduled meeting, when that is.
That's in 2
okay.
weeks.
In 2 weeks?
No, it's not.
No,
That's
it's
what she's
not.
saying.
I thought it was on the 28th, October 28th.
There is one in 2 weeks. So what I'm saying, in 2 weeks, all we're going to get is one pest control report, probably.
But we'll also have proof that the
That they're
report,
doing
that
what
they're
they say.
actually, they've got a signed contract and that it has begun, and they did XYZ since this meeting to that meeting. So I think, there's
I
a
feel
little
like
bit
it's
more
necessary.
assurances that would
So come back in 2 weeks then.
Well, 2 weeks, I think between now and the next meeting, we need to see a substantial activity that something's being done. And then the following meeting, whenever that is, we have the proponents come back and see where we're at. That's what-
So,
I agree with that.
I think that's an aggressive but really doable under the circumstances plan. I see, that's great.
Okay.
So are you able, so the meeting is on October
28.
28th?
That's fine. We're traveling abroad the first 3 weeks of November.
So then we'd want to see you before you,
Yeah, so we'll be back before,
timeline, so that would be the
Yeah.
Tuesday before.
yes, but the 2
No,
weeks
it's
after
the
that.
28th and then the
The 28th.
25th.
Yeah, the 20th is fine.
Yeah, we'll be
So
back.
we'll see you October 28th, and we want things in order, things already started.
Yes.
And then you'll come back in
On the 25th of November.
the 25th of November.
And
Because
just-
our 11th meeting is not happening.
Right, so I'll give them something in writing tomorrow, but, so we want a signed contract. So, I need a little bit
And
more.
evidence.
More detailed contract. And then we want the copy of the report from the first treatment that is out there, okay? And then you'll be coming to the meeting on October 28th, which is a Tuesday.
Yep.
Did I miss any?
I didn't mean to butt in, but I was curious about hearing from the abutter, or
Yeah.
the abutter is here. Is there any plan of action on that side?
Ask him if he'd like to speak, right?
I mean, I'd like to speak
Okay.
a couple minutes if you allow me.
Okay. I did want to give you the chance to do that because you did come, and obviously you have a few things to say, and I think it's important to hear
Yeah.
what you have to say.
Yeah, they need to.
So so we started kind of formulating a little bit of a plan with the owners because they did actively get a contract. But with that said, we do want to hear from the abutters before we go forward with our exact plan, if that's fair. So if the owners could go back and the abutter can come up, sign in, and share with us.
Do we have a chance to ask questions at the end?
Yes, we'll bring you back up in a moment.
Thank you.
So I'm Tom Vozikis. I'm at 3 Liberty Ave. I'm right behind 1 Liberty Ave. So this started back in July when I first got evidence of rats coming into my yard. Prior to that, I was seeing holes underneath the fence in certain locations closer to the chicken coop, and then I would block them. I started a couple of years ago doing like a rock garden with rose bushes along that fence because the property on their side, since they built that house in 2017, the property level on that retaining wall has dropped. And it was continuing to drop. I don't know if it was settling because the house was built in 2017 or something was being removed. There were gaps up to 6 inches below the fence. And on my end, where originally I had mulch, the rats were coming in, digging easily and getting into my property. Or at that time, I didn't know what it was. I thought maybe it was rabbits because we have a lot of rabbits in the yard. So I started removing the mulch. I put stones. They were 2 to 3 inch stones, and I put new rose bushes and all that stuff. And then I started continue. They were moving that. So I said, geez, I don't know. It's not rabbits. So I put a trail cam out because I had one in the back because we catch, there's a groundhog out there, there's a possum, so they, always in the yard, so I like to catch their activity. And it caught the rats coming underneath the fence. Unfortunately, with the trail cam, it has an SD card, and I wasn't able to load it. I don't know if you guys get the videos. I was trying to upload them to my computer, my laptop, so I can send them to you guys. And that was a daily or nightly activity of the rats coming through, and I would put more rocks there, and they'd come back in. And eventually, they got into my garden. The tomatoes were coming up, the lettuce was coming up, and then one of them eventually got in there and burrowed underneath the shed. And I ended up gassing him. I took care of that. And then I put out traps, and I've caught 5 rats on my side of the property, and they're just cheap traps that I get from O'Connor Hardware. And the rats are pretty smart. After a while, they're not going near those traps at all. So what I ended up doing is spending a lot of money on taking those rocks out and buying 1/4-inch fencing and cutting it up and burying it underneath the fence because the property now is dropped on their end like 6 inches. And then I covered it back with rocks, and that stopped the problem. And I continued that, if you ever see go to my property, all the way down to the end. It's probably about a 150-foot run. I got 3 orders of 3 yards of rocks each time because the dump trucks were heavy and I haven't then dumped them. And I did all the work myself and spent significant time and money doing this. And that has alleviated that problem, except for one section near the chicken coop. There were so many holes there that I didn't want to start messing with that and digging because I don't know if the nest was there or underneath there, the burrow. So that's the only area I haven't taken care of. And to this day, still, there's 1 or 2 rats that will come up through that area. I just covered it back up with the mulch that's on that side in that small area. But they'll burrow through the mulch easily. But I think some of that problem is because they're able to get into my property easily because their level is here, my level is here, and if the fence is up here, they just come in like this and easily digging through and coming onto my property. And that's the only thing I want to do is alleviate and mitigate the problem from them coming into, because I want to put the garden back in next year and
Right.
do whatever I need to do. And I'm just afraid eventually if the rats aren't taken care of, now they're going to start going after the trash barrels that are near the house, finding a food source. And that's where they stem from, is a food source. If there's no food source, they'll go find another area to find the food source.
So unfortunately, you took your vegetable garden out, but
Yeah.
that's helping alleviate a source of food for them.
Yeah.
Whether that brought them there or not,
Yeah.
it's just eliminated now.
And I haven't seen
Exactly.
any activity underneath the shed now anymore.
Since you took
Since
care
I
of it
removed that.
Okay.
And then I put all those rocks and the fencing in. Like I said, except for that last section, it's an 8-foot section in the corner next to the chicken coop, I haven't touched yet. I was waiting until their pesticide guy comes. I think he said he was going to gas their burrow or something like that.
Okay. So you're comfortable with them and the steps that your neighbors have started to take?
Oh, yeah.
Okay.
Yeah.
Okay. And
Yeah, just as long as we have proof that something's being done, and because I don't know what happens in the wintertime. Do they hibernate? Is there still activity? And then we have the same problem next spring.
Right.
So there's obviously some type of food source in that corner that they're going after, because that's where most of the burrows are.
Mr. Chairman, he did say that the contract would last 6 months, so that would take it through the winter.
Winter.
Yeah,
It's winter.
6 months to a year, I
Need
believe.
6 months to a year.
Yeah.
Do we have, I mean, if there's any activity, I want to continue it continuously forever, if necessary. The issue is you stop them coming into your yard, but there's still rats there.
Yeah.
We
Right.
don't want that in the neighborhood.
Agreed. Any questions or, any questions? No. Okay, well, thank you for your time.
Thank you.
We're
Thank you.
trying to work with you on this.
All right, thank you.
We'll do what we can. Do the owners want to come back up and we can hear your question that you said you may have? And if there's any questions for the owners, we can go further with that, or I think we can start putting the plan into motion to go for it.
Yeah, so we're just trying to figure out the etiology of all this. So obviously, we've had chickens for a few years, and this is
Correct.
the first time that we've heard about the rat problem. And
Okay.
from our neighbors, we haven't heard anything up until this summer. And so I'm just wondering, how long of a battle are we going to have here if we're going to start trying to tackle these guys and then they hide and then they come back out next spring and they're little babies, and so we just keep on going through. Do you guys have any data points from other towns where they had no problem to a few and then they were able to eradicate it? What do other towns do when this happens, and how do they get there?
So that's why you hired a professional
Okay.
pest control representative. So those are questions that you want to speak to him about, because they're the professionals, this is what they do.
Yeah, we've gotten a whole range of answers from like, it's forever to like, I can, power through and kill them all. So I don't know who to listen to and who to believe at this point.
If you're following their recommendations, then there should be eradication. If there is no food source, no water source, no shelter, they will go elsewhere.
And do you guys happen to know why Burlington is all of a sudden seeing these little upticks in rodent activity?
I don't know if I would say that.
Okay.
I mean, that Burlington,
It's everywhere. It's
yeah.
everywhere.
And I don't think I don't think we can answer your question as far as how long it's going to take. However, you do want to concentrate on getting rid of potential food sources.
Of course.
So being really careful about the chicken feed, the compost pile, the garden, the fruits, the vegetables, or whatever you're growing. I mean, I don't want to tell you to to pull them all up, but I'm just saying that's what you need to be cognizant of, is potential food sources for them. Because if you get rid of the food source, then, like he said, they're less likely they're gonna stick around. Or come back and, build nests, things like that.
Yeah, no,
And you
fair.
want to, ask your pest control company about nests, like gassing a nest or whatever it is that they do to get rid of those sources. Because they do multiply. And this has been going on for quite some time,
Okay, if you were me, would you just
since July, right?
say like the chickens are the primary source? Like if other people have gotten rid of chickens, has that helped?
We've never seen
Haven't seen it,
anybody
okay.
with chickens have this problem.
Okay, okay. So it might not be the chickens.
Might not.
Okay. All right.
At least I haven't. Have you, Marlene?
Not here, no.
Yeah, we're just not sure of who, like rat zero was, how they got onto our property or, yeah. So we're trying to figure out how not to have that happen. again.
Exactly, and where did they come from? It's hard to pinpoint that, so I think looking at your property and you doing your due diligence, your neighbor did due
Yeah.
diligence, if you're working together, it should help alleviate it.
Yeah.
And we can go from there.
Okay, okay. All right, so the goal right now is not like, all these rats to 0 rats in a month. Right.
I don't know if that's even possible. I have no
Okay.
idea. That's
Yeah.
the pest control person's job.
Yeah.
And if that could happen, that would probably make everybody happy. But
Right.
Again, I
Yeah.
don't know. So I think going along the guidelines from Ms. Johnson, it might be helpful to hire, get it going, you're going away, let them do their thing. If they come to your property, it's outside right now, right? So you want to be able to allow them to do their thing so that we can help remedy it. It's just hard to
Madam Chair, I
put,
have a
it's
question.
just a hard thing to put a timeline, like it'll be done by Christmas or
Yeah,
something
of
like
course.
that.
Yeah.
You're going away for 3 weeks. Who takes care of the chickens?
Their grandparents, so they
Well,
have,
they need to also abide by the orders because, you leave for 3 weeks, going to make sure that there's no food source for 3 weeks. Make sure that they're, so that's an education step that you have to do.
definitely.
With them. Because
Yeah.
when you applied for the permit, I wasn't here, but I'm assuming the same guidelines were followed.
Yeah.
And you must have a waste management plan and a food storage plan and all of that. So if someone else is taking care, they have to know and do.
Of course,
Yeah, nothing has changed in the way that we care for the chickens or our property over the last several years. So it is surprising to us to find out about the
It's
rat problem as
unfortunate,
well.
right?
Yeah, I mean, and this is a high priority for us. I mean, we have kids, we don't want them running around in the
Right.
yard with
Exactly.
with rat droppings.
No,
So this
that's
is important.
scary, yeah.
From the time that, I think when Tommy called the BOH, we had one conversation. He was like, "Hey, I called the BOH. Have you guys seen any rats?" And we hadn't at that point. So we were like, "No, we don't really know what you're talking about. We have a dog, so maybe the dog is keeping them from where we could see." We had an initial inspection where you guys dropped by, and there was no evidence in that inspection of anything.
Right.
But just from those 2 data points, we bought a bunch of traps, we laid them out, we didn't catch anything. The second inspection is when, we started seeing tunnels, and all this evidence started to appear. And so that, I can't remember what the date was, but that was when we learned that, okay, we're coming to the hearing, the best course of action is to get pest control involved, and so, we're doing that, and we are not opposed, we're going to do whatever it takes to get this taken care of.
Okay.
So what is the actual motion,
So
Ms. Chair?
we can change it to state, the board may order the permit holder at 1 Liberty Ave to provide pest control services and seal the fence according to the recommendations of the pest control service, provide copies of the pest control service reports to the Board of Health, provide a signed contract from the pest control company, and treat the first treatment as soon as possible. And then-
Preferably by the 28th.
And then, yes, and then return to the Board of Health for a meeting on October 28th.
I guess I need a motion to approve that, or is there anything else that we're missing?
No, I think we need motion.
Okay, so I need a motion to approve that.
A motion? I'll grant the motion.
Okay. Second, okay, so a motion by Andrea Sheehan, second by Dr. Mahi Shahabi. I'm sorry, I'm stumbling this morning, tonight. All in favor? Aye. So, thank you for your time.
guys.
I hope this works out.
Yeah, and, I mean, worst case, is it just quickest to get rid of the chickens? Because we just have such.
That's the worst-case scenario
Yeah.
again, but
So if we got rid of the chickens now, do we can we just hope for the best?
I don't know if that's going to solve the problem at this
Okay.
point, to be honest. I don't know, but I would be more concerned about rectifying the issue.
Of course, yeah, I just want the path of least resistance because we have our hands full. So,
Of course.
You know, all the stuff poisoning and them in the yard also has those risks, so.
Those are questions for your.
We gotta ask our guy.
person. I know.
Okay. All right.
But it's the time where people are going to be inside more, so.
Yeah.
That might be comforting to you.
Yeah, until next year, and then.
Right.
And everything comes back up, but that's okay, we'll worry about it then. Okay, thank you
Right,
guys.
one thing at a time.
Okay, great.
Thank you, we'll see you soon. Okay, so moving back to our agenda, what did I do with my agenda? Here it is. I had approval of minutes, let's see.
September 9th.
Oh, approval of the September 9th minutes. Does anyone have any questions about those minutes that were on our agenda? I need a motion to approve September 9th minutes.
I'll make a motion to approve September 9th meeting.
A motion by Andrea Sheehan, second by Dr. Sahabi. All in favor?
Aye.
Great.
Wait, I abstained.
Oh, you abstained because you weren't here, thank you.
I was in Europe.
So we have three in favor, one not here, one abstained.
Abstention.
Citizens' time, is there anyone here or online that is not part of our agenda but would still like to speak to the Board of Health? There's some people are you all part of the agenda in some way? Okay. Anyone online? It doesn't look like it. Okay, so I think we can move on. Chairman's report, I was just going to briefly talk about October rolling in. It brings all things fall, changes in leaf colors, pumpkin galore, and changes in temperature. A lot of us are contemplating putting the heat on and start winterizing our homes, but some people also like to winterize their bodies with certain vaccinations. And I did have a resident tell me how great the flu clinic was and that they really liked the efficiency of the way it was running. And that brought me into an unexpected conversation about discussing proper needle disposal. So I just wanted to remind residents that, especially those who might be using Sharps at home for whatever reason, we do have available free Sharps containers in the Department of Health, but we also collect with a kiosk at the fire station on 61 Center Street. So that was just something that was brought to my attention, and I thought people might want to live and learn from that. Moving forward, we do have two quick subcommittee reports. The first is the updates in public health by Dr. Weiner.
It's my turn.
It is your turn.
Every other meeting. Over the past few months, I've had the opportunity to accompany family and friends at many medical appointments, sometimes traveling significant distances. And I say distances because this task is becoming more and more important, and you'll hear about that in a few minutes. As someone involved in medicine for almost 5 decades, all that I can say is healthcare in this country is changing at an alarming rate. The lack of primary care physicians is becoming epidemic, exemplified by reports that some medical facilities cannot guarantee that you can immediately see a physician at their facility. In many cases, they assign you a physician extender. which is a nurse practitioner or a physician's assistant. And although these medical professionals are well-trained and competent for many exams and uncomplicated medical situations, they are not doctorally trained physician specialists. So here's our message. If you feel that you or a loved one has a serious condition, I urge you to be vigilant, advocating for their care or your care, especially advanced care. In this new age of declining numbers of healthcare professionals, with so many physicians retiring early and our rapidly aging population expanding quickly, you've got to speak up. And I'll say it again. You've got to speak up. You can't be silent. And you have to do advocacy and be an advocate. Thank you.
Thank you for that. We also had a quick subcommittee on the Wellness Committee. I myself, along with Dr. Shahabi, attended the first Wellness Committee meeting. There were a lot of people there and a packed agenda. There's a lot of different things that need to be tackled, but we did get to start with setting the agenda, a purpose of the group, and a schedule, which we'll be meeting monthly. And we did hear about a food service presentation and had a discussion about water accessibility within the schools. So we'll be hearing about that, I think, as we muddle through going. And I think Susan Luminello is going to be a participant as well. So we'll kind of work that out amongst us. Great. Moving on further in the agenda, we have two variances tonight. Unattended food establishments with Nextine. One is at 55 Blue Sky Drive, and the second property is at 95 Blue Sky Drive. There's a representative here. Please come on up, sign in on your sign-in sheet there, and then introduce yourself, and we'll hear what's happening.
All right. Hi, everyone. So Shannon Merlin with Nextine. We were just awarded the business at Blue Sky Drive for Nordblum. So we run the cafeteria, just opened last Monday. And we're looking to offer food after hours unattended in two locations. One in the main CAF location at 95 Blue Sky Drive, and then right up in the same parking lot, but the building next door at 55, which would be unattended as well.
So the variance request is from 105 CMR 590 Food Code, Section 2-10111, which requires a person in charge be present at the food establishment during all hours of operation. They did provide their plan to operate without a person in charge, so they showed the same level of protection, and the Massachusetts Department of Public Health, the Division of Food Protection, provides a guidance document for unattended food establishments, which is prepared by the Conference for Food Protection, and the document was provided to the food establishment noted above to establish a written food safety plan for the unattended food establishment. I have reviewed and approved their written plan. By following the procedures outlined in their plan, the same level of protection can be achieved. So tonight, for both of these locations, the board may vote yes to approve the unattended food establishment variance for Nextine at 55 Blue Sky Drive and 95 Blue Sky Drive with the following conditions. The food establishment shall follow their approved written plan for minimum requirements for an unattended food establishment. The variance is for the locations noted above. Any additional proposed unattended food establishments within the town of Burlington will require a separate written plan and variance. Violations of this variance may result in an appearance before the board and may result in a temporary suspension of the food permit. Continued violations may result in the revocation of the variance by the Board of Health. In the event of an imminent or threat of a health hazard, the Board of Health may suspend the food permit without a prior hearing as outlined in 105 CMR 14, Part A. The food establishment manager shall notify the Burlington Board of Health within 24 hours if there was an imminent health hazard, food tampering, and/or a food injury that occurred at the unattended food establishment. And the Board of Health may revoke, modify, or suspend this variance if, in their opinion, the level of protection is not equivalent to that provided with a strict application of 105 CMR 590, minimum sanitation standards for food establishments. Or the board may vote no and not approve the variances.
I just had a quick question. First, I liked how clear everything was. It seemed like it's pretty straightforward. But I just had a question about the automatic locking system in the beverage center or the food refrigeration. If it locks, does it automatically unlock when things go to another temperature, or does
No.
it? I was just curious.
Yeah, just, it locks if the temperature goes above the required temperatures. It'll lock down, and it won't unlock until we unlock it.
Manually.
And then remove everything.
Okay, I was just
Probably.
worried about it
Getting back
locking
to
and then
temperature. No,
unlocking, and then
it's a
food
great
being
question.
at the wrong temperature
Yeah.
and then being sold.
Yeah, it's a great
That was
question.
my one big question. Does anyone else have any
I was just
questions?
going to ask a technical question really quickly.
Sure.
So it's more of a question about why this requires a variance, because typically if there's like a self-dispensing type of machine, I mean, you wouldn't expect someone to be on site, right? But that's just
So,
curious.
that's okay. So the vending machines actually are permitted by the state, so they have to have licenses. So the state comes in and they do their inspections for those. Where this is more prepared foods involving not really so much of a machine, but actual refrigeration display unit. Sometimes they have coffee as well. So that falls under the food code, under a retail food establishment. So where they say that there has to be a person in charge. So that's where the variance comes in for those types of operations. You're welcome.
Any questions? And
I'm good. No.
I have one.
Great.
Number 5, can you define, and I've asked this same question many times, imminent health hazard? What defines, what they define an imminent health hazard, or what we define an imminent health hazard?
It would be the same.
It would be the same.
It would be the same.
I never ask a question and all the
Yes,
answers.
that's okay.
So the question is, do they have a list of imminent health hazards?
They do. We provided that. That was that.
I got
She
that.
knows, she already knows. See that?
That was my question. Thank you.
It's been reviewed, and it's on the wall, and every team member has read it and signed off that they understand what that is.
Great. So I need a motion to pass the variance at both.
Oh, we do them separately?
Can I do them separately or together?
I think that,
Okay.
I think you can, I think you should vote separately.
Okay, so I need a motion to pass the variance for Nextine at 95 Blue Sky Drive.
I'll motion that.
So Andrea Sheehan's making a motion. Dr. Sahabi is seconding that. All in favor?
Aye.
Aye, 400.
And I'll make a motion to approve 95 Blue Sky Drive.
55.
55, we did 95
50
first because that was
oh,
the primary.
So 55 Blue Sky Drive, unattended food establishment.
I'll second it.
All in favor?
Aye.
Aye, 400. Thank you.
Thank you very much, appreciate it.
So we are done with the hearing because we moved that out of order. So now we have discussions, and there's 3 tonight. I have Bow Wow Villa, 171 Cambridge Street, noise and odor control plan. So we met last meeting, right?
Yes.
Yes, yes.
Right.
So you're bringing forth a more concrete plan? Great. Please sign in. Sure. Introduce yourselves, and do you want to give us a background?
Sure.
Ms. Mathis?
As you mentioned, the applicant was here at the last meeting, giving an overview of their proposed doggy daycare and kennel facility at 171 Cambridge Street. At that meeting, the board voted to approve a special permit, to offer conditions on a special permit One of those conditions was that the applicant file a written noise and odor control plan covering multiple points of operation, cleaning and noise control. And they have submitted that for your review, and your review tonight can be to approve the plan or ask for further information and have them come back.
Okay, thank you.
I just had one question. At the last meeting, I had asked if there would be coverage 7 by 24, and you said yes. I'm curious, is that on-site or is that a remote 7 by 24 availability?
The coverage of the camera feeds or something?
No, a resource on-site.
Can you, I didn't understand, like, is it about the
An employee.
You're going to be an employee?
yeah.
Physical person on
No, the
site.
person is going to be on site physically, like, it's going to be there.
24/7.
7 by 20.
Yeah, because in the night duty, I have a person who's going to be there. I'm already kind of like done hiring him. So I think he's moving in from Texas in December, because he does that for 7 years now for a dog daycare in Texas, but the wages are too low in Texas, so he gets more money paid here. So he come in, and I'm also arranging, because I have a big house, but I also have like an in-laws apartment in Wilmington, so I'm also giving him like a place to stay too, you know? So he gets the package to stay in, and then he's gonna be like spending his night duty over there. And
I just wasn't sure if it was.
yeah, no,
on-site or
he's gonna
remote.
be
I'm
there
glad
all
you
night.
did.
Yeah, no,
I'm
he's
glad
gonna
you
be
did.
there all night.
Perfect.
Great.
Yeah,
Thank you.
and we would have employees in the morning too, but we would stop taking in like people to bring in dogs or take them out after like 6:30 in the evening. We would just lock it down and then just keep the dogs, whatever's left, yeah.
Great. Any other questions? Nothing? Dr. Ed? No? So
We already submitted like the whole plan for the soundproofing
yes,
and
we
everything.
saw the whole plan.
Yeah, I mean, I just want to say, like, whatever we've done it very, very seriously with the research, and I know it's the first thing the town is also going through, you know, for having a dog boarding. So, you know, if you guys have some instructions to give it to us, we'll follow them too. But whatever I'm doing is, everybody, you know, once we're done, you guys can come and inspect, and if there's something which is found like doesn't satisfy, we would always change it, you know. But we really want to get on board because the winters are coming in, and I have a contractor already kind of ready. It's hard to find, and then we already have things in place.
I mean, I felt this was pretty extensive.
Susan, by the way,
It was a
upload
better-
the site plan included all the outdoor play area with all dimensions, and we already uploaded and we discussed.
Yeah,
it
we
with,
also sent in the civil, that change
You
also.
remember you requested last time, so we uploaded. It's okay.
Yeah, they've seen all that.
Yeah, we already hired the same company who did the site plan.
Great.
And they will be still required to get a kennel license, so.
Right.
Yes,
How
yeah, of
will
course,
be
yeah.
The annual recommendation to the
Yeah.
town clerk
Correct.
office.
Yeah.
So
Yeah,
we don't need to come out.
No, we have to go through all this.
You'll see us.
Yeah. Once we pass through this further, we would definitely get a kennel license also.
I think that we were just looking for clarity because it was a little unclear, and you did a great job explaining.
Yeah, no, I
and putting
understand that.
The package in writing, so I'm satisfied. We're not voting on this, are we? Or,
Did we have a vote to approve?
Yeah, it was a vote to approve.
oh, okay, I'm sorry. I was thinking that it was just a discussion. So I need a motion to approve this noise and odor control plan for 171 Cambridge Street.
Point of order. I was not here at the last meeting to go through the
Correct.
special permit. Is this vote this evening just for the noise and odor control plan?
Yes.
Which I have reviewed and I can vote
Yes.
on?
Yes,
Okay,
good
fine.
point.
So I will vote.
Yeah.
Is that-
Yeah, because the
It would be
conditions
appropriate.
have already been sent over to the planning board, correct? They've already been.
Yes, so
So
you
this
were
is
absent
just
in that
for
other
this.
plan. That is just for this, because we were confused.
So it
and
would be
needed
appropriate for me to.
Yeah.
Great, good clarification. Thank you, Dr. Ed. So I am looking for a motion to approve noise and odor control plan for 171 Cambridge Street, Bow Wow Villa. Motion to approve by Dr. Shahabi,
I'll second the motion.
second by Andrea Sheehan. All in favor?
Aye.
Aye, so 4-0-0. Thank you. We're slowly getting there.
Thank you so much.
Good night.
We'll do a good job, I promise you that.
Thank you.
You actually need it.
I'm excited to see it. All right, retail program standard, Standard 9, risk factor study.
Yes, good evening. So I attached a lot of paperwork. I won't go through all of it. I'll just kind of touch on the highlights. But in the paperwork, there's a description of the goal of Standard 9, what it's all about, and the requirements that the Board of Health staff followed to meet this standard. And I provided the final report. And the final report was prepared by myself, Samantha Ellsworth, and Katie, who was one of the shared services epidemiologists. She did the majority of the work. She was one that did the data collection, went through all of the inspection reports. So basically, what was done was we took a specific group of food establishment inspection reports. We didn't count some of them because there weren't going to be any risk factor violations such as retail stores. So we focused mainly on the restaurants. We included Leahy Hospital, and we included the supermarkets and any markets that do any kind of food prep, and also the schools. And so we did an analysis to see what risk factor violation came up the most often. And so we actually found that cold holding food that requires refrigeration for safety was the most common risk factor violation that came up. We also decided to see some other common violations that had come up. And so these weren't risk factors, but they were other violations, and the other violation that we took a look at was hand washing. So it actually had more to do with the facility, not actual hand washing, but the hand washing facilities, such as did they have sinks available, were they blocked, did they have soap and paper towels, and so that we found that there were some violations there as well. So then, as part of the study, what we do is we want to then turn and educate the staff. So I know you have it on your laptops, but here's an actual hard copy that I'd like to give to each of you. And this is what we mailed out to every single restaurant. And as we do our inspections, we are talking about this as well. And so this was our very first food focus. It's our intervention for the two violations that we had found. So we introduced the risk factor study that we did to the food establishments, and then we talk about the cold holding violation, and then we introduced some tips of what to do if you do have your cold food out of temperature control. Your steps should be what to look for, managers needing to monitor these areas closely. Then we talked about the importance of hand washing and talked about the hand wash facilities, and also some tips about hand washing and making sure that those facilities are always stocked. And then on the last page, we thought we would add some other interesting information. So one is about sanitizer test kits, just a little blurb about the test kits. And then lastly, introducing the Tyler technology software that has arrived and letting folks know that they were going to be renewing their food permits online this year, which is quite different from what they're used to, and asking them to reach out to us if they had any email changes. So that was our intervention. And it was really interesting doing this. And so what the plan is with the retail program standards is you do the risk factor study, and then you do another one 5 years later, and you see if you have improvement, and if so, you know, what that percentage might be. Maybe it's a different risk factor that might show that's higher than another one. So that's what it's all about.
I think this is great. It was a lot of hard work and good information, but the data is what you're focused on. I
Right.
think that's important. Question?
So I'm curious, now that we see, I just happen to be focusing on the hand washing one, you see 48% of the restaurants, whether it's full service or fast food, how are we going to get in front of that issue? That's a pretty significant number,
Right.
in my opinion. So it's one thing to look at the data, it's one thing to retest in 5 years, but I think it's our responsibility to say, what are we going to do differently? And can you track that back to, like, of the people that participated in the survey, like, the highest offender or who had the most issues, so that you can address them first?
Right. So that's the whole reason of doing a risk factor study, so that way inspectors know where they need to focus their time. So now that when we do our inspections now, these are the areas that we're spending a little extra time on, really kind of keying in, working with the person in charge, because we're only there twice a year, unannounced. So it's up to them to really, make sure that these things are moving forward, and that they always have soap, and they always have paper towels, and that they have a hand wash sink that's not blocked. So as far as finding out who the people, the way that this is broken down, the way we have to follow the standards, is that we break it down into 4. So we got restaurants, we've got retail, we've got hospitals, and we've got childcare. So that's how it's broken down. We did break down the restaurants into fast food and full service, so, which ironically, they both were right split down the middle. So they were equally both, had the,
But they service the population significantly.
Correct.
And that, is
yeah,
is the
I know,
concern.
washing hands with no soap,
Yeah,
right.
exactly.
Having no paper towels to wipe your hands. So, yeah. And that's why we sent this out, so we wanted to bring it to people's attention. As we do our inspections, we're talking about it, we're focusing on it, so we'll see what happens in 5 years. Maybe there'll be improvement, maybe there'll be something else that we have to focus our attention on.
So this was a general overarching,
Correct.
look for violations,
Correct.
but you're still testing annually, well, not testing, inspecting.
We inspect, right, the majority of the restaurants get inspected
Right.
twice a year, unannounced. So,
Right.
but in between that, it's up to the person in charge.
Right,
to make
of
sure that
course.
they're, right, managing.
And they have the things needed to do what they need
Exactly.
to do.
Exactly, yeah.
Great.
I remember when you got the grant. This is a big deal. Congratulations to you and Ms. Ellsworth. This is a real big deal. This is not only a tremendous amount of work, this in essence is washing some of our dirty laundry too, publicly. And not only are we saying here that our food institutions need to get better, but we need to keep an eye on this, and we are. We get very few food illnesses, so we are doing a good job. The question I have is, this is an FDA grant. Did this go into the FDA? Have they seen this?
They don't usually.
They don't?
No.
But if we're doing this, I cannot believe that every single city and town in the United States is no different. Maybe a few percentages, positive, negative, but it's all the same.
I looked at them.
So my question is to you, this was a major undertaking. It was a beautiful piece of work. It was a lot of data points. Where do we go from here? How can we show this to other cities and towns across all the United States that says, look, we in Burlington, with a rather large Board of Public Health professional group, found this data, and I bet you it's no different from yours.
So there's a shared software program called Food Shield. So everybody who's involved in the retail program standards is in this software, everybody in the whole country. And so we share information. So this will get uploaded to that, so everybody will be able to look at it. And it's helpful for other people who are doing a risk factor study in their own community, because it's very difficult. It's very, very difficult. Because that's what I did, is I looked at other people, how they did it, how they put theirs together. And we had huge help from Susan putting it together so that it looks eye-appealing. So we'll be sharing that. I share everything on this food shield. And to let you know, too, I think Burlington's going to be the first health department in Massachusetts to be able to meet all 9 standards. So far, we've met 9. We have 1 more standard left, so that's what we're going to focus on next year, is standard 2. And once we meet that, we've met all 9, and we'll be the first in Massachusetts.
And we're going to go public with
We
that, big time.
absolutely are.
I think we're
I'm
going to.
planning on it.
I
This is the
intend to,
national retail standard.
we will definitely use my contacts in the news and television.
Colleen, I think it's great, but I have to go back to these numbers and say, 5 years? It doesn't look
It's a
very...
study. It's a study. You can't look at it that way. I mean, you know, you're looking at numbers to see if what you're doing, your intervention, you're focusing on the inspections, if it makes any difference.
So this is like a report card then? If other people could perceive this as a report card and say, if we've been doing our job, why are the numbers in the 50% range?
Well,
I have to say,
No.
it's not a report card for us. It's
No,
a
no, no,
report card
it's-
for the establishments. right?
Exactly.
So we are in there inspecting, we're telling them information. One of the things you have to remember too is we might go in there, you know, one time, and then the next time we're in there, it's all new management, all new people, and we're telling them the same thing over again, and they might have that violation again. So there is a large turnover rate, so that's what we fight against all the time in giving the information to people. So it's not our report card, it's really, it's on the establishments. And maybe in 5 years, we might come up again. I think one good thing, though, is that we didn't have a lot of the imminent health hazards, right? So this hand washing did not.
It's not an imminent health hazard, nor is it a risk factor. It's not a risk factor, right.
The risk factor was the cold holding. So that's something that could potentially, like, we really want to focus on that. I mean, that's where we're going to really focus on initially is those risk factors. Yeah, they should be washing their hands, there should be soap and paper towels, but we're looking, you know, immediate at the risk factors, and we only had 1, right, Marlene?
Well, right, yeah. You're looking at all 5 of the risk factors, and that was the one that came up the highest.
Yeah, so not too bad on that, I would say, not grading us, but we're grading them.
Well, I just wonder if, given, you know, these particular areas, both of them, you know, in the 50% range, should the twice-a-year inspection be moved up to on a, you know, quarterly or?
So we don't have the staffing
Yeah, I was
capability
going to say it's probably a
to
manpower.
do that, number one. Number two is we are meeting the requirements of the regulations in the amount of inspections that we do. And when you think about it too, we are also adding in re-inspections. So say we have 200 and something establishments, right? Some of them, we're going out once, twice, 3 times a year. But then if they have a violation, we're going back out again. So we're doing, you know, we are always, Marlene, Sam, Taisha are always out on inspections because they're also doing, when a violation is found, a re-inspection. And we don't let it go, we don't let the re-inspection go, we're back in there within a couple of weeks.
Right, to make sure that it's been corrected.
So there's always there's that follow-up too. I don't think, I mean, yeah, I guess that would be an ideal world if we could get out there more often, but it's just not possible, you know? And it's not required. It's not a requirement under the food code.
I'm actually shocked that with this percentages of like non-hand washing and everything that we're not seeing more like.
Well, it's not, they are washing their hands, but that violation is,
Not in the proper way, right?
right, they might be missing, right.
Exactly. So maybe they're wearing gloves, I don't know, afterward. I'm just surprised, that's all.
Yeah, and it's always a snapshot in time. Too,
Right.
Yeah.
When we go in.
Yeah.
So They might not have had soap
Yeah.
today, but they had
Yeah.
soap yesterday.
Right.
That type of thing too. So it's like,
Yeah.
when are we going there? We're maybe seeing them at their worst, you
Right.
know?
And we're pretty tough. I mean, I train the inspectors, write what you see, write what you see. So, I can't speak for other towns and cities, but, sometimes people, might, hey, you have no soap. Oh, yeah, I'll put it in, and then it doesn't get recorded, But we're really tough here, and we've got that reputation that we're tough, so.
And I can
You can
vouch for
attest to that.
I
Yeah,
can
you get
attest to
peop-
that.
Yeah.
And actually too, that may be a report card, for us on the positive end, is that we're finding these things.
Right.
We're seeing them and we're finding them and we're following
And
up with them.
following up to make sure it's fixed.
Right, and we're educating and make sure that people understand the importance.
I think overall, this is wonderful.
This
Thank
was
you.
a lot.
Thank you.
We should celebrate this.
Once we hit.
We have one more to do.
Standards.
One more to do, and we will celebrate it.
So there's no vote here, right? Okay, so we're moving on, just discussion to shared services update. Rebecca Marion, public health nurse. Thank you for waiting.
Thank you. Okay, thanks for having me tonight. Susan has my presentation, so you guys can look along while I speak. So my name is Rebecca Marion. I am the public health nurse for the Tri-Town Coalition, which you're aware of serves for 3 towns, Burlington, Lexington, and Wilmington. And I'm so happy to be in this position as I was born and raised in Burlington. So I'm happy to be back and serving my community. And I'm married and I have a 4-year-old daughter. So this is a little bit about me and my background. So when I was about 18 years old, I joined the United States Army, active duty, and I even had a tour in Iraq for a 1.5 years. Once I returned home, I still was active duty reserves, and I became an EMT. So I worked for Armstrong Ambulance for quite a few years, also serving in Burlington at the time because we didn't have paramedics yet on the fire department. Then I decided I want to be a nurse. So I went off and went to Mass College of Pharmacy and Health Sciences University in Boston. And that's where I obtained my Bachelor of Science in Nursing degree. And while I was there, I went on 2 medical mission trips. So I went to Arequipa, Peru, and Agadir, Morocco, twice, so a total of 3 trips. So while I was there, we set up like rural health clinics. We did vital signs, HIV testing, ultrasounds out in pregnant women, all sorts of wonderful things, preventative treatments. And as you can see in the photo there, I was doing some wound care and taking some vital signs. And that was kind of a pivotal moment for me where I really enjoyed public health, because over there we worked with public health as well. So I really enjoyed that, and that kind of just like started my passion.
Great.
So since I've joined here, I was part-time in March, and then I became full-time in July. I have done since July 31 blood pressure clinics within the 3 towns. I've done 2 Narcan trainings, 3 Stop the Bleed trainings, 3 Matter of Balance, which consists of 8 sessions each. 1 emergency preparedness, 1 summer safety, and I was an instructor for 4 CPR classes. So we've been busy, as you can see from my photos. I've also done the, oh, sorry, you could go back. That's okay. The 2 top photos next to the wording there is the health fair. The one on the left was the Board of Health Fair.
Nice.
And the one on the right was the Council on Aging. And then there I am with some of the other nurses from Lexington and Wilmington down in the middle picture there for Stop the Bleed. So we're a great team of nurses. And this is a new program that I've initiated since I started. So we know that falls is a huge problem with the older population. It's actually results in 3 million emergency visits a year, with hip fractures being the #1 injury. So there's tons of, programs and people out there trying to do things to, reduce those number of falls. And one of them is called STEADY, Stopping Elderly Accidents, Deaths and Injuries Initiative by the CDC. So I incorporated all their information and I turned it into a program. So you can schedule a 1-hour appointment with me, and this is basically what I do here. It's a screening process of 12 questions. Then I go through a very comprehensive head-to-toe assessment, reviewing your medical history, medications. I check your eyes, your footwear. And we do 3 tests to check your leg strength, your balance, and your gait, which is how you're walking. And then we have an intervention part, which is where I give you a resource folder, and we give you some fall prevention socks, which have been a huge hit. And as you can see here, I know we don't have too much data since we basically just initiated it in August, really. July we had 1 person. But it's been publicized in the Daily Times Chronicle. It's on flyers around town. It's in the senior newsletters. And 2 Fridays a month, I'm at the Wilmington Senior Center going forward. So we're hoping to see the numbers go up. We didn't have it scheduled in the newsletter, so I think that's why we had a little drop in September, but we put it back in the newsletter, so I'm already booked for this Friday and the next Friday in Wilmington.
Great.
Wonderful.
Yeah, and then we also added an additional blood pressure clinic with the Burlington Housing Authority on the first Thursday of the month.
Awesome.
Yep. And so for future goals, just want to read this. So for finally, future goals within the Tri-Town nursing area is the Office of Local and Regional Health, OLRH, has gathered and analyzed data from our 3 communities and has identified maternal, child, and family health as a gap within our 3 towns. So in order to close this gap, the Tri-Town Coalition has been working on a resource list within the 3 towns, as well as expanding our Vaccines for Children program in Wilmington. The Vaccine for Children's program is already established here in Burlington and Lexington, and the goal is to offer this program in Wilmington utilizing myself as the nurse to deliver the vaccines to these children. So in addition, once we form partnerships with the local resources in the 3 communities and find what is needed, we hope to expand on future programs to provide services to all families and continue to increase health and wellness for all. Thank you.
This is wonderful.
This is great.
Yeah.
And thank
What
you for all your
percentage of
service.
time do you spend in Burlington? I know your office is here.
Yes.
I know that I went to your amazing emergency preparedness program.
Thank you.
But what percentage do you spend in Burlington?
I'd probably say maybe like 75% or 65% maybe of my time is in Burlington, because I'm doing a lot of research and looking up programs and brainstorming, doing the resource list. But I go 3 times a month to Lexington for blood pressure clinics. I've filled in a few times in Wilmington for the nurse there. And I usually attend the ones in Burlington here at the COA, so.
It's great. We're happy to have you, so
We're
thank
lucky
you.
to
Thank you so much.
We
Yeah,
are.
I appreciate
for
your
your
time.
Thank you for your service.
Thank you for your service.
Oh, thank you very much.
It's amazing.
Thank you. Okay.
Yeah, so Rebecca's doing a great job, as you can see. Is becoming more and more wanted in the other communities. She's doing a lot of flu clinics now in Lexington. I think you've been there. at least
Oh, yes, I forgot to mention that. I had it all written down, but.
And there, so she's been at all of their flu clinics as well. So it's, even though she's sitting in the office, she's still doing the work for Lexington and Wilmington. Maybe not there all the time, but like she said, researching the programs and what she's going to do. And the maternal and child health thing is in the work plan for this year, and then will be extended most likely to next year, as well as, okay, we have the resource list, now what programs can we work on? And Rebecca will be like instrumental in accomplishing that part of the work plan.
It's exciting.
Yeah.
It's great.
Yeah, I'm really excited about it.
Thank you. Thank you.
Thank you so much.
Thank you.
Thank you. Do I need to sign it?
Very good.
Oh, I didn't ask you to, but
We know who you are.
I'll sign it anyway.
let's be official. We
I
ask
was
everyone
here.
to sign in. Thank you. That was my faux pas. Okay, so we're going to move on to our staff reports, and we're starting with Health Agent, Miss Marlene Johnson,
Okay.
RS. And
So,
do you have Samantha's in there, too?
okay.
Just so we're all aware.
Sure, no problem. So if you looked at my report, I provided a clarification about the temporary food events, because we had a couple questions come up regarding that, when a temporary food permit is required.
Oh, I liked that,
When
yeah.
one is not, a potluck dinner, bake sales, what the difference are with those types of events. So I sent that out to primarily the schools. The schools were the ones that had the questions for that. I also issued a variance revocation, because Legal Seafood is no longer doing sushi. So they had an acidification variance. So since they weren't using it, I revoke the variance, so that way it forces them in the future, if they want to bring it back,
They have to come.
update the HACCP plan and come before the board again. So
Great.
just like to keep.
I wasn't sure if that was because of a violation, so thank you for explaining.
No. If it were, I would have them come before you, and you
Right,
would
okay.
decide what to do. But where they're just not doing it at all,
No need to leave it out there.
right. And then we had a food safety forum, and that was part of the standards as well. So we do Standard 7. Every year we have to have industry and the consumer, invite them to some sort of a meeting or forum. And so this is what we did this year. The topic was foodborne illness, so I send out an email for anybody who's interested. It's more of a discussion than anything else. So we had about, I think it was maybe 7 or 8 food service managers attended, and we talked about foodborne illness, what it is, and how you can get it, the symptoms, our role as health inspectors when we investigate it, how we go about that. And we asked them if there was anything that they needed from us as far as training goes, or just to help them do their job. So it's always great. It's only an hour, and we always get a lot of good feedback from everybody. So that's what we had as well. And I included my report. Any questions on my report?
Madam Chair, I have a couple.
Sure.
First, it's always find it interesting that customer, a mouse customer, that the public really reaches out to you, and I think that's fabulous that you're able to find all these. I am assuming that you also are going to be cover Ms. Ellsworth's report, too?
Sure, if you have any questions.
Yeah, she found a foodborne illness out with a violation. What was the result of that violation? I'm not going to ask you whom or whatever.
Right,
Is that-
right, no.
With the violation, what did we do for them? What did we do?
So she suspected that it was mushrooms that were part of an ingredient to several burgers that the family had consumed. And so she found, when she did the inspection, that they were out of temperature control. So she suspected that potentially maybe the day that they were there and ate the burgers, that maybe that's what had happened. And so she wrote it as a violation because it was a violation during her inspection. And so I actually had followed up on my report because she was out of the office, but I followed up to make sure that that was in compliance.
Okay, good.
Thank you.
You're welcome.
I just had a question, if I can speak on that. I was just curious about the cold plunge tub question, or is that something that some of the gyms are offering, and there was a question about sanitary, or?
So there was a question about if they need to be permitted or licensed, and so that would be the state. So we
Okay.
contacted the state to find out, are there regulations?
Right.
Right now, there are no regulations.
Well, it's
for
such a
that.
new trend.
And so they are not required to be licensed or permitted through the local Board of Health. They're right now, they have to follow the recommendation of the manufacturer for for those
Okay.
times. Yeah.
So there are, it's not like a pool, because like it's separate.
Right.
It's not a hot tub.
Exactly.
Yeah, okay.
It's very, very new. It's
Okay.
very, very new, yeah.
It just piqued my interest, thank
Yeah.
you. That makes sense.
Yeah. And I guess you're only in there for maybe a minute or so.
Yeah.
It's cold water.
Not me.
Right. Oh, thank you.
I don't know if I'd make it.
Have you tried it? No. Motion
Oh, thank you.
to approve,
Say it's very, very healthy for you, though.
I
motion
know.
to approve the health agent's report, which includes the associate health inspector's report.
Motion by
second.
Marwa, second by Andrea. All in favor?
Aye.
Aye. Great, thank you. Moving right along, we're going into environmental engineer Christine Mathis.
Good evening.
Hi.
First, I wanted to thank both Dr. Weiner and our chairperson for helping out at Household Hazardous Waste last month. We had a good turnout, about 320 residents. Wasn't a crazy day, but it was a steady day. I also wanted to highlight that I had the final risk levels for EEE and West Nile virus in here. And as of Friday, October 10th, sampling and trapping and sampling of mosquitoes has ended, but mosquitoes are still concerned until the first hard frost, which is defined as 28 degrees or less for 4 hours. So we haven't had that yet, although it felt like it a
I know, I
couple
was
of
gonna
mornings.
It did feel like it, but, yeah.
I double-checked it today, and we haven't had it yet.
Okay.
It's not in Burlington. But sure did feel like it some mornings, didn't it?
Yeah.
Anyway, any questions on the remainder of the report?
Well, that leads me, I did have a question, if I may. It was, I noticed something about continuing stream cleaning over by Daniel. Were we not doing that?
Oh, no, it was an inquiry as to, we asked them to go take a look at the stream and see if it appeared that stream cleaning would be in order.
Okay.
If, there were a lot of blockages and down stuff, branches and stuff like that. And they said that there was, some down branches, but the stream was flowing pretty well and
Okay.
probably wasn't warranted at this time. We had them go out and inspect because it tied in to some investigation that Susan had going on with rats.
Right.
Yeah, so I asked Christine to reach out to mosquito control about the stream because there has been a lot of rat activity in that area along Daniel Drive. We've gotten a lot of calls from the residents over there. It's an ongoing thing that we're working on. The apartment complexes and the businesses in the area have to make sure that there's no trash in front of their dumpsters, and that their dumpster doors and tops are closed. So again, it's getting rid of the food source, getting pest control, the residents are getting pest control, the businesses and apartment complexes in the area are working with us and are being cooperative in doing that. So, but we're continuing to go out there and take a look. But one of the things that I wanted to make sure of was that stream wasn't, that stream was flowing to make sure that it wasn't providing a good water source there.
Okay, that makes sense.
So that's why I
Okay.
wanted to just kind of check it out to make sure that it was still flowing, because we do have money in our budget for them to go out, I forget how many hours it is.
12 hours.
12 hours or so for them to do this, so that, I wanted to look at that area as like maybe a potential if we needed to do that. But they said it was flowing fine, so.
Okay, that's good.
Yeah.
Yeah, I went out there and just checked for access points for them to sort of give them a map and, here's where you can say, and I looked at it from 3 different vantage points, and it was flowing the day I was out there. And then the personnel from mosquito control, he went out, accessed it from Middlesex Turnpike Extension. It goes underneath Middlesex Turnpike Extension. So from there, and he walked it all the way back up to its origin.
Okay.
And he found that it was flowing quite well. And that's what I saw also. So I think I went on a Friday, and he went the following Tuesday or Wednesday. And on both occasions, there was good movement.
Good.
Great. Thank you. So I need, any questions? Any other question? No? A motion to approve environmental engineer staff report.
So moved, Madam Chairman.
Second.
All in favor?
Aye.
Aye. Great. Moving right along to our next staff report, Michael Green, Associate Director of Public Health.
Thank you, Madam Chairperson. I'd like to just thank all the staff and volunteers that worked so hard and put together really fantastic flu clinics last month and earlier this month. We were able to get rid of all of our high dose and most of our regular dose.
Great.
We still have a few clinics coming up and some employee health fairs that will be providing flu vaccine at. Overall, pretty good season for those. I'd also like to say that we are hopefully having a hybrid NIMS 700 class for the BBRC. Unfortunately, with the federal shutdown, the FEMA site is not operational at this point for training. So we may have to reschedule that one for a later time when that does come back up. So
Interesting.
some good, some bad.
Yeah. Any questions?
I have none.
I don't think I had any either.
I don't either, no.
I closed my book too, so, okay, no. All right, so I need a motion to approve.
Second.
All in favor?
Aye.
Aye. Thank you. Moving on to Director of Public Health, staff report with Susan Luminello, and to include Supervisory Nurse Sandra Troiani. Report.
Yes, so Jennifer Walsh started today as our new part-time administrative assistant. Today was her first day. Sarah was sick today, so she really got broken in, and food permits are due tomorrow.
Oh, gosh.
So she was answering a lot of phone calls today on the food permits and the
Great.
Software. So,
How you learn.
yeah. And on the subject of the food permits, the deadline is tomorrow, October 15th. We've sent out numerous emails, phone calls through, the reverse 911 system, letters to the establishments. So I really feel as if we're, at this point, done chasing everybody down.
Great.
And as of November 1st, if we don't, November 1st is when their permits expire. If we don't get everything in, their application, all the materials that go with it, and their fee, we're going to close them down for operating without a permit. We're already prepared to do
Okay.
that. Marlene, Sam, everybody in the office, myself, Mike, if whoever's available is going to be working on that the next day, because we can't keep chasing people down. They need to be responsible and renew their
And
permit.
how many
Yeah, I was just going to
are not in compliance?
Huh?
About how many are not in compliance?
Well, when I looked today, it's quite a few, yeah.
Okay.
Are these repeat,
Hopefully they'll come in tomorrow, because tomorrow's the deadline,
are these repeat offenders? Like, are they just,
I think probably there is a lot of repeat. Last year we didn't have any, but I don't know if we were so strict about it last year. Like, a lot of times we were making phone calls and say, hey, you need to come in with your fee and all that. But we've
It's like,
done
you can't
a
do
lot
that
of
for
that,
every- yeah.
already to this point. So we're going to.
But at what point does it become their responsibility?
Right. And, it's not, we're available for questions. And if you can't use the software, then you need to just reach out to us. We've sent out various ways, guides and everything else. to get, you can come into the office and fill it out.
Do it
and we
together.
have a computer available. So I don't think we've made it difficult. It should be, we're providing a lot of help and assistance with that.
Okay.
So, we did this with the hazardous materials, having them come to a board meeting if they don't have their application, if we haven't had any offenders on that. So I think we now need to kind of do that with
Yeah.
food permits, so we can, they know that we're not going to keep going past this November 1st deadline.
Right. And the software will help us organize that, and maybe the change is what's difficult.
Yeah,
You
it's-
know what I mean, for
yeah.
them, but they have to,
Right, it's,
Yeah.
I mean, everything is electronic now. You know,
Right.
you really kind of need to move away from paper,
yeah,
you know?
yeah,
So-
agreed. Great, any questions, or,
I have
okay.
Triton part-time openings, communication specialist, epidemiologist, health inspector, any more?
That's it. Those three are the part-time positions that are now open. The health communication specialist and the epidemiologist positions have been advertised. We've got a lot of resumes for those, and hopefully we'll be starting interviews for the, well, we have dates set for that. I think it's next week. Mike's going to be helping
Great.
out with that. And then we haven't advertised the part-time inspector position yet. That was something that Lexington wanted, because they've been really using Type-Share a lot, and their inspector, they're short-staffed, and their health inspector is going to be out, for quite a while. So they really anticipate they're going to need a lot of inspections done, so that was the reason why for switching out the community outreach worker for the health inspector, because Lexington really said they needed that, so that's where we're going to head for at least this fiscal year.
Great. Sounds good. Is that all?
That's it?
All right, so I need a motion to
So
approve.
moved. I move that we approve the Director of Public Health report, which includes the and supervisory nurse. Thank you.
I'll second that.
All in favor?
Aye.
Aye.
Aye. Meeting adjourned. Oh, I need a motion. I am jumping the gun. I need a motion to adjourn the meeting, please.
Motion to adjourn.
Second.
Second.
All in favor?
Aye.
Aye.
Good
We're
night,
done. Good night. Oh, my gosh, that was a big one.
Very nice job.
Do you want me to switch this off, Susan?
Yeah.